Good morning, students. Here we are. It is Wednesday. It is already hump day. It's already the middle of the week. Just one more day this week. Anyway, yesterday we went over, yesterday we went over the paralleling technique and what a periapical is, and we went over a bite wing, how to position it, what are the basic principles of the paralleling technique. We went over what the basic principles are concerning the bite wing technique. And so we're going to take it a little bit further today, and we're going to talk about exposure errors, right? So I keep talking about the things that make a quality x-ray, and it needs to be diagnostically capable. We have to be, there's no reason to take an x-ray if we cannot use it to make a diagnosis, okay? Basically in dentistry, you have to have two things to make a diagnosis. And it's pretty much, I would think, the same way in the medical profession. One is you have to be able to duplicate symptoms, okay? If a patient comes in complaining of a problem, we need to be able to duplicate what they're saying is happening with their tooth, okay? We can't just treat it because of what they say is going on. We have to prove it, what's going on before we can, and with 100% certainty, we have to be able to prove what's going on with their tooth. The other thing is we have to have an x-ray to prove it. So we've already talked about x-rays and students, patients not wanting to have x-rays done and what to do in that situation. So a quality x-ray, right, has to have proper exposure. We've talked about that already. So now proper processing. Digital's taken a lot of that problem away. We've gone all through last week. We talked about the quality assurance. How do you prove that your chemicals are right, your film is okay, and all that situation. So now we're going to talk about how we make sure that the exposure is proper or the positioning of it is proper. You know, yesterday we talked about paralleling and how in dentistry, and it's the same way when medical x-rays are taken. We want to make sure that everything is parallel to one another, whether I'm taking an x-ray of your arm or your head or your foot or in your teeth. Everything needs to be parallel to one another. So basically, what I'm talking about is that if I have a mouth, and I'm going to go get a mouth, just one second. Sorry about that. So if I have this mouth right here, okay, there we go. And this mouth seems to have some issues today, okay? So if I have this mouth, right, and, whoops, gotta get in the place where the camera is. I have this mouth right here, and I'm gonna put a film in it, like so, right? It needs to be parallel to my teeth, which means I want to put it in here like so. I'll just move his maxilla. I want to put it in here like so, where it's going to be parallel to the plane of his teeth. And then if I take my water bottle, which would be my PID, because it's kind of shaped like a PID, this needs to be parallel to my teeth, like so, okay? If I have my PID horizontally positioned wrong, so if I'm going to move it, say, if I move it this way, say, let's say this way, right? You can see that it's not perpendicular to my film. Whoopsie, say this way, right? It's not perpendicular to my film. It does not make a right angle with my film. So what's going to happen is I'm not shooting through my contacts, right? So shooting through my contacts means that I'm shooting directly perpendicular to where my film is placed, right? If I shoot perpendicular to my film, which is like this, So say this is my PID, it's a little bit easier to hold. So if I'm shooting perpendicular to my film, like this, so my film is perpendicular to my mandible, right? And then my pen is perpendicular to my film. I'm basically shooting right through these contacts, and I'm going to have an open contact. So if there's any decay right here, I'll be able to see it, right? But if I take my PID, and instead of being perpendicular to my film, I'm like, it's kind of this way. I'm like this. I'm not perpendicular to my film anymore. And what's going to happen is I can't see through my contacts anymore. Okay, because if I go to this side, right, all my contacts are going to overlap each other. The same way as if I go to the distal, the same thing's going to happen. So I always need to be perpendicular to my film. So that's what happens if with overlap contacts. I always have to be perpendicular to my film. All right. So let's just make believe this is a bite wing. But the same thing would happen if it was a periapical. I always have to, and this is horizontal because I'm moving this way, right, from side to side. Okay, but it can also happen on a periapical, right? We want to always be perpendicular to our film. Now, if I move, the same thing can happen with my film. If I put my film in my patient's mouth and it's not parallel to my teeth, and I move up here and my film is like so, because if we move it too far forward, I'm going to have to do this because we have this curve, right? We have a curve here where our canines come into play. But all I really need is the mesial of this premolar. So I don't want to move it too far forward. All I need to do is here, right? Because always concentrate on the teeth I'm getting an x-ray of. I'm getting an x-ray of these two teeth. So I don't want to move it too far forward because what's happening to my film is turning. So even if my film turns like this, I still need to be perpendicular to my film in order to get what I need. But if I turn my film too much, like so I put it like this, and it's not parallel to my teeth anymore, right? If I'm parallel here, and I'm still perpendicular to my film, but my film's not parallel to my teeth, I'm still going to get overlap contacts because now my film's not parallel to my teeth. So everything needs to be parallel to one another. My film needs to be parallel to my teeth, and my PID needs to be perpendicular to my film. So pretty much we can't just throw my x-ray in there without looking. And it's really all about looking too. I get so upset even when I go to the dentist and the hygienist or the assistant throws an x-ray in my mouth and they don't pay attention to what they're doing. And then I look at my x-rays and my x-rays are all funky like this, or they come all the way down here, right? Because don't forget, it has to be perpendicular this way, but also it needs to be perpendicular when I move my tube head up and down. So I'm gonna try to move my camera here a little bit because this thing is getting a little heavy. Let's see if you can still see if I move this down here. I'm gonna turn off my, see if I can turn off my, I know there's a way to turn off my, let's see if I could do it here. Let's see if I could turn off my background here for just a minute. No, I don't want to turn that off, but I'm going to turn off my background for just a minute because it's kind of getting in my way right now. There we go. All right, so I'm going to move this over here a little bit. Sorry about that, guys. All right, so that is, all right, well, hi, Lexi, how are you today? I'm gonna go back to my video. Something just happened to my video. All right. Are you there, Lexi?
Yes, ma'am, I'm here. I just got on. I'm sorry I'm late.
That's okay. I'm just trying to get my video back on because I've got a mouth here and I'm trying to do a demo here, but I don't know what just happened to my screen. It kind of disappeared on me. There we go. All right. So I'm trying to go through some of the exposure positioning errors here. I've got this big old mouth that's kind of heavy. All right. So we just kind of went over horizontal positioning, goes from side to side. Now, vertical positioning would be my PID coming, whoops, up and down this way, right? Moving the tube head this way. So some things can happen there that are also wrong. And I just have this little card here, it's being my film right now. So some things that can happen that way also is that, now when we put the film in the patient's mouth, I guess I wasn't very prepared here. I wasn't going to do this, but some things that can happen also is your vertical positioning, right? So when we take an image on the maxillary, our PID needs to be plus, right? We have plus and we have minus. Plus when we move our PI tube head from the top, and minus is positioning from the bottom. So when we do plus positioning or plus angling, it's going to go from the top. And one of the main things that we talked about, or that chapter 17 talked about, was the angulation and how important it is to make sure that you put the film far enough into the mouth or away from the teeth. And I had mentioned that on the maxillary, the big problem is that your palate does not move, right? It's solid bone. So what happens there is that we have to make sure that we angle the film enough, whether it's digital or whether it's conventional film. And with digital, it's actually a little bit easier because the film actually will not bend like conventional film does. Okay, I have something a little bit harder. So what's going to happen is that I don't have a film holder here with me. I've got this. So this is the bite block for a conventional XCP. So your film would go in here, and then it would go in here. And so what's important is that on the palate, on the maxillary, is that you'll put your film here and then have your patient close. Now, if I put it in and it's too close to the teeth, what's going to happen to my film is that if you look here, you see how my film bends because it's too close to the teeth. So what I need to do is if I put it more into the middle of the patient's mouth, because the height of the palate is in the middle, the film's not going to bend. And we also have to remember that the teeth on our maxillary go in our mouth this way, right? Because our maxillary is bent, right? It's not straight. In our mandible, our teeth are straight up and down like this, which is good because underneath our tongue is all muscle. And so our film won't bend when we put it on our mandible. Okay, so some of the hardest teeth to take x-rays of are going to be on your maxillary. And what you need to do is make sure that you put it enough towards midline so that we can get the curvature of the teeth, but we can also make it far enough away so that the film doesn't bend and we make sure we don't get any distortion. So that being said, so if your film is in your patient's mouth like this, okay, if your film is in your patient's mouth like this, and now we have a PID that comes up here, we always have to make sure that our PID is perpendicular to our film, right? In order to get, basically what they call it is a shadow image, because if this was, say, a flashlight, so if we make believe that our X-ray beam is a flashlight and our tooth is on there, if you make believe that, say, our tooth is this pen, right? Actually, if we may believe that this is an X-ray beam, what we're really doing is getting a shadow image of our tooth on our film. That's what they kind of call it. But if you think about it, if I'm not perpendicular to my film and I'm at an angle like this, and my angulation is too much angulation, it's going to make my image look shorter, right? Because I'm shooting down on my tooth. It's just like if you're taking a selfie, right? And you hold the camera all the way up here, right? If you take a selfie and I hold, say this is my person and I hold my camera up here, what does it do to you? It makes you look shorter and wider. So on my film, it's the same thing. If I have a tooth right here, but now I'm shooting from the up here, my angulation, I'm not perpendicular, and I have too much angulation, it's going to make my tooth look shorter. From the other standpoint, if I have too little angulation and I come from down here, it's going to make my tooth look too long, right? The same thing in the selfie. You know, if I bring my camera all the way down here and I shoot up on myself, then it's going to make me, maybe my head look really long, or it's going to distort me. So, you know, there's a really fine technique in taking a selfie. You know, I can't take a selfie for anything. I hate having my picture taken anyway. But when you take a selfie, in order to have a good, you know, image of yourself, you really need to take it, you know, unless you're trying to make yourself look skinny or trying to make yourself look short, but you really need to be straight in front of yourself, right? So it's the same way with your teeth. So I always say too little, right? Too little angulation. Wait a minute. Too little, that's this way, sorry. Too little makes my tooth look too long. So too little, too long. Too much is too short. Students get this mixed up all the time. So basically, too little, too long, too much, too short, okay? But it's all about this. Everything needs to be straight on or perpendicular to my film. I'm lecturing. I'm lecturing. I'm lecturing. I'll be out in a second. All righty. I don't know why they don't understand those words. I'm lecturing. Okay. Got it? I hope that helps. But that's also why we've been talking about, you know, getting the perfect quality of X-ray. What we want is the tooth to be exactly like it is in the patient's mouth. We don't want any changes from the length of it at all. Because what happens is that, I mean, if they're going to do a root canal on that tooth, they may need to use that, they will need to use that X-ray to determine the length of the tooth from the incisal edge or the occlusal edge to the apex to get them an idea, right, of what the length of the tooth is. Does that help? I hope it helps. All right. So now I'm gonna stop sharing me, and
Yes,
we're
that
gonna.
did help.
That
I
help?
remember. I remember when we did the X-rays with Dr. O. That was my main problem. It was either I was getting the tooth where it's like either too long or too short.
Right. And the thing you have to remember that even if you use that XCP and the aiming ring, it's not always right. Okay. We get too dependent on that aiming ring because you always have to remember that it's always about being perpendicular to your film, right? And so, because really, eventually, I should be able to take that aiming ring away. And some offices are going to, they might not have that aiming ring, okay? Some offices may just have this bite block right here. Some offices might just have this, you know? Some of my students were like, can I just learn how to do it with the bite block? Because that aiming ring is throwing me completely off. Because once I explained to them that that aiming ring may not be accurate, right? Because a lot of times when you go exactly by that aiming ring, you know, and then they have that circle in the middle, you're going to miss the apex, and you have to kind of go up just a little bit more, like to the outside of the ring, instead of being right in the center of that ring, especially with maxillary molars and premolars, because it's just different. You know, it's not always in that aiming ring, and you get kind of a sense of a false hope, thinking, okay, I got this, I'll just do this and it'll be perfect. And what's really important when you what I find is really important when you take x-rays, probably one of the most important things, is looking at what you're doing. Too many, I mean, when I go to the dentist, too many times they won't look where they're, you know, they'll just kind of shove it in my mouth, and then they won't get a good x-ray, or they'll hurt me. And it's because they get so lackadaisical about it. You know, it's like, okay, I'm just going to shove it in their mouth. But you have to look at where you're placing your x-ray. You know, everybody's mouth isn't the same. You need to retract their cheek, right? You need to look at where you're placing the x-ray is so important. I've been taking x-rays for 40 years. And every time you get a little bit better at it. And even if I haven't taught this mod and taken x-rays in a couple of months, I always feel a little bit inept. You know, I'm like, wait a minute, I have to go and take some x-rays because I haven't taken them in 6 months. So there's little techniques that you need to practice doing. No matter how good you think you are, you still need to, like, pull out the cheek, you know, look at what you're doing. I mean, the last time I went to the dentist, I was upset because when I saw the x-rays that she took, I was like, you got to be kidding me. These are terrible x-rays. And I was surprised. Like, if I was the dentist, I would have said, oh no, you need to retake this one and this one and this one, because there were certain things that I couldn't see on the x-ray if I was the dentist, but I'm not the dentist. I should have gone to dental school. Okay. So I'm going to go through here because I want to get to mounting x-rays, because you can read through this. We did all this, right, when we were in mod 2. So there's things that can happen, right? Exposure problems. If the receptor is unexposed, basically it means that it's going to be blank, right? There's nothing going to be on it. It's going to be clear because somebody it's not exposed to radiation, okay? Maybe you didn't turn on the machine, but basically it wasn't exposed to radiation. If it comes out all black like this, it means that it was exposed to light. So if it's on manual film, somebody opened the packet. It doesn't usually happen with digital film. Here, it appears dark because it was overexposed. So somebody, the settings on the control panel were too high. So you need to make sure that before you take every x-ray, that you make sure that the control panel is set properly. So make sure, when we talked about the control panel and there's like a little chart, like a little diagram that'll show you which teeth that you're exposing, make sure that you check it before every exposure. Like, don't just, if you're taking bite wings, that's okay. But if you're taking like a full mouth series, or you change your patient, make sure that you check to see it's set, make sure it's set for an adult versus a child. Make sure it's set like this one, this is lower anteriors. Well, maybe the patient before this was set at, mandibular molars, which takes a higher exposure of kilovoltage than would mandibular anteriors, because there's a difference in the thickness of the bone. Okay, so always check your control panel. The same thing where this is underexposed, you always need to check your control panel. This was probably set maybe for a child instead of an adult, because a child uses less radiation than an adult does. Okay, so the only thing that I can say is that on this, you also have to go think about if you have a little old lady that's like 80 years old versus an adult. Their bone is starting to break down. So if I had like a little 80-year-old patient here, I would probably set it for a child instead of an adult, because you also have to go by the size of the patient. An adult setting on a little tiny old lady may be too much for her also. So you have to kind of take the size of the patient in hand, the same way we were talking about CPR, right? If I have the rock in unconscious, unresponsive, I'm going to have to push on his chest a lot harder than I would a little old frail lady that weighs 100 pounds. So you kind of have to take your patient into consideration too when you take exposed radiographs, the same way you do with CPR. We talked about a child versus an adult. It depends on the size of the patient with CPR as much as it does with exposing radiographs. Do you have any questions about that? Does that make sense?
Yeah, it does make sense of that you have to set it for like a child, because it's kind of like, how like whenever baby comes into this world and they have like, barely any teeth or small teeth and stuff, I would kind of expect that for an older lady, right?
Yeah, yeah, because I mean,
Yeah, so
yeah, because
it
like
makes
my son's mother-in-law
sense.
is like so tiny. She's this little like 4'6", barely weighs 100 pounds lady, right? Now, when she gets to be 75 years old, I probably would set her exposure for a child because she's really tiny. So you have to kind of take some of those things into consideration when you're exposing radiographs too, because the thickness or the compactness of her bone is a lot different than a regular adult. So you have to kind of think about some of those things, okay? So this is going to talk about periapical technique errors that can happen, right? And this is a periapical, right? Because it's the entire tooth from the incisal edge or the occlusal edge past the apex. And so this is, I would think, a pretty good x-ray, but so this is the correct peri placement and demonstrates the entire tooth. So if you miss the apical structures of it, there's no apices and an excessive margin or receptor edge, which means we have lots of this. It's not positioned in the patient's mouth to cover the apical regions. So to ensure that the apical structures appear on the receptor, the teeth being imaged must be firmly in contact with the bite block. So basically this person is not biting down all the way, right? They're not biting on it, okay? So we need to make sure that we tell the patient that they need to close all the way on it. And that would happen if you're not like looking at what your patient does. When you put the film holder in their mouth, make sure that you watch that they close their mouth all the way. And if it's uncomfortable for them, think about this. The middle of your mouth has the most room to it, okay? So if we put the X, we may need to reposition it closer to the middle of their mouth, because patients are not going to want to bite on them because it's uncomfortable. And it's really hard for me to explain it on here, but there's a place in your mouth. Let me show you something real quick. All right, so on your mandible, and this happens with little kids all the time, you know, in the middle of your mouth here, so you're going to have them lift their tongue so you can put the film between their tongue and their mandible. There's a pocket right here, and you can feel it on yourself, but there's a pocket that's right here by your molars that you can stick your finger down really far. So my thing, if I have a patient that comes in and they tell me, I can't bite down on it, I'll take my finger and I'll put it right in here and I'll go, look, my finger will drop down right here about this far, you know, like this far. I'm like, sure you can. You can close your mouth, you can bite down on this x-ray without a problem. Okay, so there is a little pocket right there where your finger will go. And if you go more towards the middle, you can actually get the image, the film in. Just have to kind of talk to them. You know, some people just don't want to cooperate in the world that we live in right now. They just kind of want to, you know, you have those arguers with you. But another thing that you can do, you can put it on the top of their tongue if you have to, but they have to be able to relax their tongue, which is something that's kind of hard to explain to them. Relax your tongue. If they're very defiant and they will not let you put the receptor underneath their tongue into that little pocket back there where your molars are, then you can actually put it on top of their tongue if you have to. The thing is, though, is that you have to straighten the film up to make it parallel to their teeth. So we can't have it at an angle. Again, this is improperly placed because they don't have their teeth biting together all the way, because this needs to be up here. So the occlusal of the teeth or the incisal edge always has to be up here. So they always have to be biting on it. This is the angulation problems that we talked about. And this one is this is incorrect horizontal angulation. So if you look here, right, we have these contacts that are overlapping. So in this case, the PID was not perpendicular to the film, right? They weren't shooting through the contacts. So we have to make sure, and they keep saying that, shoot it through the contacts. So, you know, they say it all the time. So we have to make sure that not only are we not shooting too little, too long, too much, too short. Not only are we having it too much up here or too much down here, but we also have to shoot it straight on from this way. Now here, they're too far to the distal, because you see here the contact is overlapping on the distal. So you would actually have to move your PID more towards the mesial, and these contacts would open up. So say this receptor is still in the patient's mouth, and you took a digital image and it opened up and you saw this and you're going to retake it, I would go ahead and move my PID more towards the mesial because it's overlapping here on my distal. The same way, if I took this image and I saw contact overlapping on the mesial, I would move my, what did I just say? If it's overlapping on the distal, you move it to the distal. If it's overlapping on the mesial, then you move it to the mesial. Don't listen to me. I just kind of got much going on. This is a foreshortened image, right? You can see how short these x-rays are because they had too much vertical angulation. These are elongated. Look how long and stretched out these are. So they shot it from down here, right? They were supposed to shoot it straight on. They came down here. They had too little annulation. And so it made these teeth look long and stretched out. This is a cone cut because the film was not in the middle of the PID circle. Okay, so half a part of it was missed. Again, here's another cone cut. This is the correct image, right? Because we can see a black line through every tooth. You look right there, that's actually calculus right there. So if a patient has that and they tell you they've been flossing all the time, you know that they're lying to you. This is the incorrect placement of a premolar film because on premolars, we're supposed to get the mesial of this first premolar down here, and you can see that they don't. So you want to make sure that you get what you need to get, right, on the x-ray. So if I'm taking a premolar shot, concentrate on these premolars, and I want to get the mesial edge. Now this is a bad molar shot because I can see the third molars, but it's not on my film. If you don't see the third molars, then don't worry about it, okay? Again, here we have overlap contacts. So if this is a molar shot, either way, it's not getting all the molars. And if this is a premolar shot, we barely have the mesial, but we have overlapping contacts. Distorted, we had too much angulation from the bottom. And so these teeth look all stretched out. Again, we have a cone cut. And I'm not quite sure. I guess this is a little cone cut. Okay, so I'm going to let you kind of finish reading this over. So this is distortion. So when the film bends on the palate, so it was not placed further enough into the midline, you can see how this bends. Again, here is another bent film right here. And these are all kind of the PCP or the film kind of bent here. Okay, this is another creased film from bending. This is a damage to the digital plate. This is just debris that's on there. They're kind of artifacts that are on there. You can see here, this is a finger. Okay, this is a phalange that's showing. I do not know how this happened, but I don't think it can actually happen in real life because that means that your finger would have to be on the wrong side of the film, right? If it goes behind the film, there's lead foil that would stop your finger being seen. So I think this is a Photoshop picture. This is a double image. Okay, so you can see that this film was exposed twice. That's why it's so important to make sure that you keep track and you have a special order, like you keep, an order of which you expose your films in. This is another double image. You can see right here that this was exposed to your anterior, and then, I don't know, kind of looks like there was another film back here. This is movement and this is blurred because the patient moved. There's a little bit of movement in the tube head, but it's not significant enough to show the blurred image. So a blurred image like this is going to show maybe if my patient sneezed, moved their head, went to answer their phone. This is a backwards image with conventional film. You can see these little tire tracks right here. Now the film that we have, the phosphor plates, have a magnet on it in order to pull it through the scanner. Now with us, if we have it backwards in the patient's mouth, that magnet is going to show up on our radiograph. So we always want to make sure that we put it in the patient's mouth the correct way. All right, so that was a pretty quick run through of chapter 20. So now I want to go to how to mount them. And there's actually an exercise in Evolve that I put a link to that will help you practice it. Did you have a chance did Dr. O show you how to mount the x-rays that he had you take?
No, he never showed us that. I think they were the digital ones that we did, so we just put them in on the screen of the computer.
He didn't show you how to mount them at all? Okay. So the reason why we mount x-rays is to put them in anatomical order, right? So that when we put them out, yeah, so that is it here? No. Is so that we can put them in order, so that when the doctor goes through them to diagnose them, or when he, okay, it's chapter 28. Okay, we're here. Where's the chapter? 24. 24. Oh, it'll be in this one. Okay, I was getting nervous. I'm like, where is the chapter? So this chapter mainly talks about mounting films. Okay, they talk about how the film has a dot on the slot and how we have these different types of mount. But basically, film mounting is basically placing the radiographs. Here they talk about in a supporting structure or holder, placing them in anatomical order so that they're easier to view that way, right? Instead of just having a bunch of radiographs sitting around that we don't know where they go in reference to the patient's mouth. But a lot of this chapter basically talks about, these type of film holders. The beginning of the chapter is going to talk about, that they need to be cardboard or some type of dark plastic because it's easier to see that way. But we're going to be taking radiographs digitally, and it doesn't really talk about, whether this is going to be black or cardboard or stuff like that. It talks about the film mounts are in different configurations depending on what type of films they're taking. This one, it has, so this dentist takes, instead of taking 18 films, they take 19, right? Because they take 4 maxillary interiors instead of 3. So it basically depends on, this film mount is made especially for that dentist. Most dentists take 18 by 18 FMXs, 18 x-rays on an FMX. They take 3 anterior, they take 4 bite wings, and then they take 6 posterior periapicals. This is all the different types of mounts that you can see there. Where and when are the films mounted? Usually we mount them as soon as we process them. Why we use a film mount? Because they're quicker and easier to view. They're stored in the patient's record. Nowadays, digitally, they're stored in the computer. If we're using a manual film mount, this is the information that goes on it. In our computer, it's already set up for us, right? Digital images are observed on the computer monitor, must also be arranged correctly in an anatomical order in order to view them properly and to interpret them. Only the dentist is allowed to diagnose the films. We are not allowed to diagnose them. We can interpret them, but we're not allowed to diagnose them for the patient. In the computer software is going to be, there's a way to have, to mount them on an FMX. You can take a single x-ray, You can put a Panorex in there, so it's already set up. You can click and drag it to where it needs to go, but basically you need to number it. Did he show you how to number the x-rays, or did you just take x-rays? Okay, so this is basically what it's going to look like on the computer. But you do need to know how to mount them and how to look at the x-rays to tell if it's a maxillary molar or a mandibular molar. And all that is done by looking at the anatomy of the tooth. Normal anatomy, when you look at the bite wings, so when you mount it digitally, you don't have to worry about turning your film over. You don't have to worry for a dot and a slot. But there's some things that you do need to know. So if I pull these x-rays up on my, or it pops up on my computer, I need to know where the curve of SPE is. So this is my bite wing x-rays. The curve of SPE, because our upper arch is rounded and our lower arch is concave, I would automatically know that my curve of SPE kind of is like a smile. So if I pull up these bite wings and it showed my curve of SPE going down, I would automatically know that I need to turn my x-ray with my smile going up. The other thing that I would look at on these x-rays would be that it's kind of the same way it is on a chart when I chart my patient's teeth. It's still going to be that my right is on my left and my left is on my right. So when we look at a dental chart, right, on the outside are my molars, then come my premolars. So when I chart it, when I mount them, I'm always going to know that if my molars are on my left, it goes on the left side of my mount. If the molars are on my right, it goes on the right side of my mount. So since these teeth are on my left, it means that this is going to be tooth number 2 and 3, 4 and 5, just like it is when I'm charting a patient in Dentrix. Now, what that dot in the slot does, basically there's 2 methods to mount films manually. There's the labial method and the lingual method. And both of them rely on this dot in the slot, and I'm pretty sure this will be on your RDA exam. So if I'm doing manual films, this dot always goes in the slot, and you can feel it a little bit. It's used to orient the patient's right and left sides. So if the dot is raised, that means that it's labial mounting. So it's like the dot is facing your lips. If it's depressed, it's lingual mounting. All the dots need to face in the same direction. So one thing is you can't have some of the dots facing up and some of the dots facing away. Labial mounting is the preferred method of mounting radiographs and it is recommended by the ADA. That didn't happen until, I guess, around 1990 somewhere maybe. So with the labial mounting, radiographs are placed in the mount with the raised side of the dot facing the viewer. That's just like we chart. It's identical to how we chart. If we did it the other way, that would be lingual mounting. That would be with the dot facing the patient's tongue. And it would be like I was standing behind the patient facing out. It's a complete opposite of how we chart a patient's teeth. So if the dot is facing us, it's just like we chart with us facing the patient, where this is the patient's right side and this is the patient's left side. That is labial mounting, and that's recommended by the ADA. Lingual mounting this picture's wrong. Lingual mounting is with the dot away from the viewer. The depressed side of the identification. They seem the same thing. Side of the dot. Where is the place in the film? Raised convex side of the dot facing the viewer. It says the same thing. Place with the depressed concave side of the dot facing. Okay, sorry. Yeah, but this picture's wrong. So the dot is away from you, right? And it's like we're standing behind the patient. So the dot is facing lingually and it's behind the patient. So you should have a way that you, step-by-step procedure that you use in order to mount your x-rays. Here they're talking about manually mounting the x-rays, right? We're going to start with a mount. Normally you would orient all your dots. You would separate, say, you would orient all your dots facing up. Then you would separate all your bite wings into 3 groups. Your bite wings, your anterior periapicals, and your posterior periapicals. And then you would orient the roots. So you would take all your anteriors and place them vertically. You would take all your periapicals and place them horizontally. Then you would orient maxillary and mandibular. And so with maxillary, we should all know that our maxillary molars have 3 roots like this. And our mandibular molars are bifurcated. So they have 2 roots like this. That's how I would tell them apart. So if I had a maxillary periapicals, I would put to the side, and then my mandibular ones I would put to the side. I would know that if my molars are on the right side of my film, I should be able to tell that these are molars and these are premolars. How can I tell that? Because molars have 3 roots, premolars have 1 root. So if I have molars on my right, they're going to go on the right side of my mount, like so. If these molars were on the left, I'd put them on the left side of my mount. Other thing that you can look for is this is your sinus right here, right there. That's another way to tell that these teeth are maxillary teeth. These are some helpful hints. Some other things that to notice that they don't talk about in this chapter is if you're doing anterior teeth. Okay, so this tooth right here, if you look at it and you look, this is a maxillary central incisor. How do I know that? Well, if you look at the size and the shape of this crown, right? Our maxillary, the crown on our maxillary incisors is very broad and big. If I compare that to your mandible central incisors, our teeth are tiny on the mandible. So which means that the crowns are tiny, the roots are tiny, they're shorter. So those are some things that you're going to look at when you're looking at your anterior periapicals to compare which ones are on the maxillary and which ones are on the mandible. These are some helpful little hints, but you do need to know basically what the teeth look like, the difference between your maxillary anteriors and your mandibular anterior teeth, and think about what they look like, the shape of the crowns of the teeth, which will help you. The people that view films, we all view them. Dentists, dental hygienists, and dental assistants, we all can view them. You should have normal knowledge of the landmarks of your maxilla and your mandible and kind of those related structures. We can interpret them, or we can explain what we can see on the dental radiograph, but we cannot diagnose it to our patient. View boxes are used to look at manual x-rays or film-based x-rays. If we're going to be interpreting these, they should be done in an orderly fashion. We should start on the left side with number 1 and then move across to the right side. This is kind of the order where they say you should do it. Of course, you should do it in an orderly fashion. These are some of the things that you're going to see on a Panorex, right? These are your sinuses. This is your mental foramen. And they just have some things that you should be able to pick out on a Panorex radiograph. Here is just a little diagram of how you should mount your x-rays, how to mount bite wings, how it talks about the curve of spee. But I really want to show you this one thing before I get off here today, because I want you guys to work on it. So I'm going to go back into your textbook real quick, which is right here. And everyone should have access to Dentrix. I'm sorry, not to Dentrix, to Evolve, which is the textbook website, because you had access to it when you were in DA 153. If you go to the modules, and down here, I put a link, which I'm going to move up here to today. There we go. If you click here, and you're going to click right here, just click on the above link. Let me log back in. Let me log in. Now you guys should have access to this from the time, like I said, when you were made an account with Dentrix. Made an account with Dentrix with them. So what'll happen is you'll come here and then you open patient number 1. And this is an interactive mounting. If I move this up a little bit, you should be able to see what I want you to see, I'm hoping. So how this works is that you're going to click and drag your radiograph into the spot. Okay, so I'm going to look. So this is a bite wing radiograph right here. And let's see if I can do something so that we can see this a little bit better. I guess not. How about if I make it a little bit smaller? There we go. How about there? Okay. So I always like to do my bite wings first, because not only it also gives me some anatomy on the tooth, or something to go by. So like this has this filling right here, so I can use that to mount the rest of my periapicals. So if I drag this here, and it does not stay, that means it's not right. So that must be my premolar shot, which is not a very good, well, it is. Okay, so then I can kind of scroll down here and look at some more. So here's another bite wing. I believe this is my premolar right here. And I can kind of go around and look for another bite wing. Whoop, there was one back here. Sorry about that. Okay, here's another one. These are all rotated properly, so I don't have to turn them around. So they're all oriented properly. So here, okay, I know that that's a mandibular molar shot because it has 2 roots on it. And if you look, it still has that curve of spee that goes like a smile. So, and I can match up. I'm going to put it here so I can show you. Okay, I can match up. This shows that this tooth number 19 has this amalgam filling, and I can see this amalgam filling right here. Okay, so I still want to find my other bite wing. There it is. Okay, so we have 4 bite wings. So I have 3. I know this one's going to go here. All right, let's see what's at the end here. All right, so this is a maxillary tooth. I can know that because it kind of has a little bit of a curve. And if I look really close, there's a sinus right here. I believe this is the premolar shot. And again, this tooth has a amalgam filling on tooth number 3. So I'm going to try to put it right here. There we go. And it stayed, so I know it's the right one. I'm going to go back here. All right, so here, right here we have tooth number 30, the third molars are missing. So this is tooth number 30 with an amalgam filling. I'm gonna, let's see, do we have another periapical down there? So this is number 30. You see it was further back than that other one. So I'm gonna put it there. So this one now is gonna go here because it has the premolars on it. So it's back here. So this is gonna be a maxillary anterior. Oh, the roots are facing up, right? So I know it's on the top or on the maxillary. And this looks like it's going to be a canine. So I'm going to put it right there. Because it's definitely not the anterior teeth, like your centrals, because it doesn't have 8 and 9 on it. This one is going to go right here. So I want everybody to do this for an assignment. This is my, right, because the roots are facing down. I know it's the mandible. This right here is the chin. Okay, and you can tell by the size of the crowns of these teeth that it is a mandibular image also. So I have this one. I have, this is the patient's canine on the left side, and now this is going to be on their right side. This one is going to be, I have this same, right? It's the mandible. The roots are facing down. They're bifurcated. This is going to go right here. Okay. This is going to be, because it's straight on, it's going to actually be these centrals right here. Right? When we take an image of the centrals, whether it's maxillary or mandibular, we get a pretty good straight on shot. Okay. This is going to be, right? It's going to be your maxillary molars because it has these 3 roots. We have this matching amalgam filling on tooth number 3. And we have this huge sinus. All right. Again, this is going to be an anterior because it's vertical. Okay. And there's only one that we're missing, which is this canine. It goes along with this bridge that this patient has. Looks like it's from canine to canine. And you can kind of tell it's a canine shot because it's, first of all, it's not straight on. I don't know if you remember when I talked about taking your canine on the maxillary because of the way that your mouth turns at that canine, right? That you're not going to get like a good straight on shot like you do with the centrals. This one here, right? We can match up this filling that's right on this tooth number 14. We're going to put it here because it's really far back. So it's not a premolar shot. And now we have one left. And we're going to put it right there. All right. So I got a 90 because I put one in the wrong place. So when you're done, what I want you to do is take a picture of this. Okay. So for now, I'm going to show you how to do this. I'm going to, or you can do this. You can take a snippet of it. And I'm going to save it. You can do it this way if you'd like. I can save it as a picture. I can name it FMX1. Whoops. You can name it FMX1. Or if you take it with your phone, you can do it the same way. And I can save it. And now I can close out of this. I can go back to my exercise. Well, for you guys, you would, when you open the exercise to do it, it'll say something about submit assignment. And then you'll have, you can do it as a photo or as a document. You would hit photo and then upload it and hit submit. Okay. I'd like you guys to do that. And then I'll put some more mounting assignments in. You can do patient 2, patient 3 as we go along. There's some great things in Evolve. that I really want you guys to make use of. This is actually for your radiology book, but if you go back, I think I mentioned this before, if you go back into your regular textbook, there's even some more. If you go to student resources, and you go here, I've showed you guys this before, so I want you guys to be doing this, or I'm going to make it an assignment and just showing you how to do it again. And you go to radiography exercises. I can open a patient and then mount their x-rays, because this is what you're going to see in real life. Computer images we take here on our mannequin, that person has perfect teeth, but this is what you need to practice on. Again, here, right? If we go to the bite wings, this one would go here, right? Here we have this bite wing of the premolars, it's going to go here. So I want you guys to use your textbook. You all should have an account with them, and you can all do this. So I'm going to make more and more of these available to you because I want more and more of you using it. Do you have any questions on how to get there, Lexi? To the book that I was showing you and to that link, you're going to have to be logged into Evolve in order to access that homework assignment that I did. But you should all have made an account with them when you're in DA 153 to access that textbook that you were using in Gentrix, okay? So I'm going to end here. If you have any questions, let me know. If you, for some reason, can't get into your textbook or to that exercise, make another account with Evolve. All right? I will see you at 12 o'clock because I'm going to make, I'm going to show you guys how to put matrix bands on a Tibodont. I will see you later.
Okay.
All right. Have a good one.